各位. Hello, everyone. Welcome to join our seminar today on long COVID and COVID association neurologic symptoms. And with us today are Dr. LaHue and also another doctor, Dr. Santhosh, will be joining us later. 多謝各位嚟參加我哋今日嘅講座嚇。今日係我哋嘅第27個講座，係講長新冠肺炎嘅另外一個講座，第27個啦，我哋做咗。咁我咧就係 Diana Lau 劉雪艷，係呢個講座嘅主持。So I'm Diana Lau. I'm the host of this town hall, and I'm director of the Asian Health Institute at UCSF. So with us today now, Dr. Sara LaHue is here with us from Mission Bay. Thank you so much, Dr. LaHue, for taking time out from your busy schedule to help us out with the community, trying to understand more what's going on in the intensive care units with our very sick patients. She is the assistant professor in the Neurohospitalist Association at UCSF. Here, Dr. LaHue obtained her medical degree, completed neurology residency where she served as the chief resident, and subsequently completed a Neurohospitalist fellowship. She has won several awards for her clinical care, education initiative, and research. Her main areas of research center on understanding the mechanisms of aging and neurodegeneration in older hospitalized adults with delirium. LaHue 醫生咧係我哋加州大學舊金山分校神經病學嘅助理教授嚟嘅。咁喺呢度咧，Dr. LaHue 咧其實咧就係喺呢度讀醫科，咁然後咧就攞咗個學位，咁啊跟住留低咧就擔任咗做呢個神經內科嘅住院醫生嘅首席醫師。咁咧就完成咗佢神經住院醫師嘅研究員嘅培訓之後咧，就繼續嚟喺度工作嘅。咁咧佢咧就由佢嘅臨床嘅醫療照顧病人啦，加埋佢嘅教育計劃同埋研究咧，曾經獲過好多個獎項嘅。佢係一個非常之好嘅醫生。咁佢主要嘅研究嘅領域咧，就係了解呢啲神志失常嘅住院老人嘅衰老啊，同埋神經退化嘅機制嘅。咁我哋係好歡迎 Dr. LaHue 醫生今日嚟同我哋做呢個講座。So thank you so much, Dr. LaHue. So the agenda today is very full. So after the short introduction, we are going to have Dr. LaHue jump into her topic of interest, telling us about the COVID-associated neurologic symptoms. And then our second speaker, Dr. Santhosh, and then she'll answer her questions about long COVID, which many of you probably will be very interested in listening to. 咁呢個咧就係我哋今日嘅項目啦，就係兩個醫生輪流講，講完之後就，但係佢哋講完，因為佢哋嗰個時間係非常之逼啊，所以佢哋咧就唔可以全部咁留低嚟到同我哋一齊嘅。咁一個講完咧就答咗佢嘅問題，然後咧就第二個講咧就答佢嘅問題，咁然後咁樣做嘅。我哋通常咧就係兩個講完就兩個一齊留低答問題噶嘛，但係我哋今日咧就要改變下我哋嘅方法，因為佢哋太過忙啦。
Thank you so much for having me. I've really been looking forward to this, mostly because I usually speak with medical providers, and I'm really thrilled to have the opportunity to speak more with community members, especially families who may have their family members in the hospital for these problems.
咁Dr. LaHue 話咧，佢多數係同啲醫生做講座，但係就好少同病人做講座嘅，所以佢今日咧就非常之高興可以同我哋社區嘅人士咧做呢個講座。
So there's so much that you can do for your family member, and that's really the focus of what I'll be talking about with you all is what is it that you can do if your loved one is in the hospital to help them with some of these key complications of COVID.
咁咧呢個咧就係佢今日講嘅題目啦，就係話如果啲病人真係唔好彩染咗新冠，然後要入咗醫院嘅話，咁你哋可以做啲咩嘢嚟幫到佢哋咧？咁呢個就係今日嘅主要講嘅嘢，同埋話俾你哋聽，佢哋嗰啲病人喺醫院度你係探唔到佢噶嘛，咁係有啲咩事發生咧？
That's the focus that I'm taking with these three topics: delirium, headache, and stroke.
咁咧佢就會講3樣嘢俾你聽嘅。
So what is delirium? Just to make sure that we're on the same page, delirium is a syndrome that's described by the symptoms of confused thinking and being disoriented. So an example of that is someone may not know what the date is, they might not know where they are. And this is something that develops quickly and can come and go.
咁咧，首先咧，其實講下喺醫院住嘅病人咧，好多時咧都有啲神志不清嘅，即係神志失常啦。咁咧，佢話咧，佢哋咧就諗嘢咧就會係思想混淆啦，同埋即係連自己喺邊度都唔知咧，又唔知係咩時日啊咁樣啦。咁咧就亦都認唔到人嘅。咁我哋通常咧就係3樣嘢，一個咧就係地點，一個就時間，一個就人物。佢3樣都可能認唔到嘅。喺不同嘅時間，但係呢啲嘢咧可能好突然間咁發生啦。但係咧發生嘅時候咧，佢有時又有時又冇嘅喎。咁所以咧，佢係即係個神志嗰方面咧係有啲問題嘅。
So this kind of acute confusion is a common reason for someone to be brought to the hospital in the first place, and it's also something that can develop while they're in the hospital.
Excuse me. 咁咧，呢啲人嘅呢啲咁嘅神志失常嘅症狀咧，好多時咧就係因為咁樣而佢哋要被送咗入醫院嘅。咁但係亦都有啲人咧係入咗嚟醫院先至發生呢啲咁嘅情形嘅。
There are many other signs to indicate that someone may have delirium, and those things include change in someone's kind of thinking. So they may become more sleepy, less interactive. They may even appear depressed. They might be sleeping more during the day, or maybe sleeping more during the day and so sleeping less at night. And then the converse, and so they might become more agitated or restless, or even experience hallucinations where they see things in the room that aren't actually there.
咁佢呢個神志失常咧，仲有其他嘅象徵嘅，即係除咗認唔到人，唔知道喺邊度同埋咩日子之外咧，佢仲好多時咧就成日好似即係烏眉瞌睡咁啦，同埋咧人哋同佢想同佢講嘢啊咩或者做嘢，咁佢係好似冇咩興趣啊，咁成個人咧就好即係有啲抑鬱嘅，咁日頭瞓好多啦，咁晚上咧就瞓唔着嘅。咁個人咧就成日覺得好焦躁，同埋好似坐又唔係，企又唔係，成日都好似唔安樂咁。有時咧仲有啲幻覺添，即係冇嘅嘢佢以為有，冇嘅聲佢以為聽到有嘢咁。
And so then why does delirium happen? So it's more common if someone is older, if they have underlying memory problems like dementia, or if they have problems with their hearing or vision. And this is something that can happen at any age. So it's more common in older adults, but can even happen in children.
咁咧，呢個係delirium 呢個神志不清咧神志失常咧係幾時喺乜嘢情況之下會發生咧？咁即係乜嘢情況就講唔實嘅，但係我哋知道乜嘢嘅情況係可能會發生，係多啲機會發生，就係喺年紀大啲嘅人啦，即係你年紀大咗啦，就有可能呢啲症狀。或者係已經係個記憶係出現有啲毛病嘅，咁咧亦都係會可能有呢啲咁嘅症狀。咁咧或者咧係睇嘢同埋聽嘢嘅能力差咗嘅時候咧，佢係令到佢容易神志失常嘅。咁咧但係神志失常呢樣嘢，我哋話老啲嘅時候可能會發生啦，但係咧其實係乜嘢年紀咧都可以發生嘅。
So why does delirium happen? Well, there are lots of things that can cause delirium. Just to name a couple, being sick is a frequent reason why someone might become delirious. And so the COVID infection itself can make someone delirious, just as something like a urinary tract infection can also cause delirium. If someone is very sick and requires being in the intensive care unit, that really increases their risk of becoming delirious. And then there are some other common reasons for hospitalization, like needing surgery, or even something simple like being dehydrated. These are all things that could contribute to someone being delirious.
咁喺咩情況之下會有呢個神志失常咧？除咗係之前啱啱講嗰個或者年紀大啲嘅諸如此類嗰啲啦嚇，咁呢啲咧就係 更多嘅情況咧係可以導致神志失常嘅。一個咧就係譬如你有病，咩病啊？譬如染咗新冠病毒啦，甚至於嗰個尿道係感染嘅，尿道感染好多人都有噶嘛，但係都可能會導致神志失常嘅，或者係病得好重嘅時候啦。咁如果佢要喺呢個深切治療室嗰度嚟到病房喺度醫治嘅咧，好多呢啲病人咧都會有啲時候咧係神志失常嘅，或者做手術啦，做完手術之後咧係好多病人都會有一段時間係有時有有時冇咁有神志失常嘅。同埋有一樣嘢咧就係老人家係更加要留意啦，就係脫水啊！老人家好多時候有脫水嘅狀況，因為佢飲水唔夠。如果尤其是天氣熱嘅時候咧，係好可能有脫水嘅情況發生嘅，咁咧亦都會導致神志失常嘅。
So the reason why it's so important that we talk about this is that delirium is very common. So about 1 in 4 people who come into the hospital will have delirium at any point during their hospital stay.
咁點解我哋今日要講呢個神志失常咧？就係因為好多病人咧入咗醫院之後咧，都有呢個神志失常嘅情況發生嘅。4個之中咧，可能有1個人嘅。咁所以咧係一個非常普遍嘅情況啦。咁我哋咧就知道，當新冠病人入到醫院嘅時候咧，啲屋企家人啊都冇辦法去探佢哋嘅，因為要隔離啊嘛。咁所以咧，佢如果有神志失常咧，你可能都唔知道嘅，所以你可能係要同醫生講嘅時候問下咯。即係4個人之中有1個，普遍嚟講。
And then in the intensive care unit, that number can go up to about 3 in 4 people can develop delirium. So again, much more common in those who are critically ill, such as someone with COVID who requires being in the intensive care unit.
咁醫院就係講普通病房啦，就係4個人之中有1個啦。但係如果當嗰啲病人喺深切治療部嘅時候咧，咁又更加犀利啦。咁嗰陣時咧就變咗係4個之中咧有3個都可能有有時有有時冇呢個咁嘅神志失常嘅情況發生嘅。
And I'll add that this is both a feature of how sick someone is, but also because of the care that they need in the intensive care unit, which requires lack of sleep and those types of things that can increase your risk of becoming delirious.
咁Dr. LaHue 咧更加補充咧就係話，可能呢個就係因為佢哋根本個病況係嚴重啦，所以會神志失常啦。但係另外一樣嘢咧就係個環境令到佢神志失常嘅，因為醫院嗰啲燈喺個深切治療部嗰度咧真係成1日24小時都唔熄燈嘅，咁整到你即係烏烏隆隆都唔知道係日啦，因為夜又成日有好多雜聲啦，啲人又成日嚟去啦，咁所以個環境係可能導致個病人神志失常嘅。
So there are lots of things that we do here at UCSF to try to prevent delirium. We have a specific program here that focuses on screening people for delirium and then using that to inform different kinds of care, specialized care that then we can provide people who are at high risk of developing delirium. And I'm going to go through some examples of what those things are and how, as family members, you can work with the medical team to enhance the care of your family member.
咁我哋即係我哋醫院咧，甚至係其他嘅醫院咧，都會喺呢方面咧係會做一啲嘢咧，去盡量防止啦呢個病人咧嘅神志失常嘅。我哋將呢件事話俾你聽咧，就係等你哋知道，如果係病人入咗醫院嘅時候咧，呢件事係好多時都會發生，但係咧亦都有啲嘢係可以做，可以幫到佢哋嘅。
So this is just to emphasize that one of the main goals is to promote wakefulness, and there are several easy ways that we can try to do that. Things like keeping the shades up to let light in, keeping the lights on, orienting the person about what the date is, where they are, getting the patient up out of bed, going for walks, keeping them engaged. All of these things can make someone more awake and engaged throughout the day.
咁其中一樣嘢咧，就係幫啲病人咧，等佢係保持清醒嘅。點樣保持清醒咧？即係譬如日頭咁啊，拉起啲窗簾啊，或者如果係唔夠光咧，着燈啊，將嗰啲日期啊，同埋嗰個照顧佢嗰個嗰啲醫護嗰啲名寫喺一個黑板嗰度，等佢知道係邊個嚟係我嘅護士，今日係星期幾，係幾多月幾多號，或者係幫佢哋企起身去行下出去個冷巷，或者喺個房嗰度行下啦，或者係要佢係同佢傾下偈，等佢可以即係有一啲活動啊，係令到佢可以清醒嘅。
And this can all help then promote sleep, because if you're more active during the day, that's going to help you sleep at night. And there are other things that we can do to facilitate this. Things like keeping the lights off, turning off the TV, minimizing caffeine intake. And we also provide eye masks and earplugs, because unfortunately the hospital can be a noisy environment. And a lot of the things that we do in the hospital can keep people up at night. And that's unfortunately one of the risk factors for developing delirium in the first place.
咁我哋話呢啲嘢俾你聽咧，其實就係等大家知道咧，喺醫院裏邊一個病人咧，我哋唔係話淨係醫生嚟巡房俾藥佢食打針，即係唔係淨係做嗰啲咁嘅嘢嘅。我哋喺其他嘅生活方面咧，都照顧佢哋，希望佢哋係減低其他呢啲咁嘅唔應該發生嘅嘢發生嘅，即係神志失常呢啲嘢啦。咁咧，其中一樣嘢我哋知道佢係成日烏眉瞌睡啊，日頭瞓唔到啊，夜晚黑咧就即係日頭咧就成日瞓，夜晚瞓唔到噶嘛。咁我哋而家咧就將佢要改變翻佢正常翻啲，等佢日頭就唔好瞓咁多，夜晚咧就瞓。咁我哋講咗點樣唔等佢唔使瞓咁多啦。咁而家夜晚點樣幫佢瞓咧？咁就有不同嘅嘢可以幫佢瞓咯。咁熄燈啊，閂電視啊，靜啲啊，唔好俾一早即係到咗某一個時候咧，就唔好俾啲有咖啡因嘅嘢俾佢哋飲啊，或者係俾佢戴個眼罩啊、耳塞啊嗰啲咁嘅嘢，等佢盡量有一個安靜嘅環境可以瞓覺。
So there are lots of things that families can do to help prevent delirium. And these all sound really simple, but they have a big impact. And so these are, I think, key things that you can do if your loved one is in the hospital to help prevent delirium. So the first one is to bring in hearing aids and glasses, and then to also ensure that water is within reach to prevent dehydration.
咁咧，家人咧都有啲嘢係可以做到嘅，除咗我哋做之外，咁你就即係譬如係戴啲眼鏡啊，戴啲助聽器啊，等佢可以聽到睇到，同埋咧或者係啲水啊擺喺佢側邊嗰度，佢係可以自己去倒水啊咁樣。做呢啲好少嘅嘢，好細微嘅嘢咧，但係都係可以幫到個病人，等佢係比較正常翻嗰個生活啲嘅。
And a bit like what I mentioned earlier, helping your family member stay awake during the day, either by visiting or because of recent restrictions with COVID, even just talking on the phone or by video can have a huge impact. And then additional activities you can do just with talking, having conversation, reading together, playing games if you're there in person, all of these things to help keep someone engaged during the day.
所以呢啲嘢，我相信係好多朋友都會做。如果有家人喺醫院嗰度，咁但係你咧就唔知道你哋做嗰啲嘢原來咁有用喎。咁而家多LaHue咧就話俾你聽，你哋做嗰啲嘢咧，你日頭去探佢嘅時候，可以幫佢保持清醒，可以同佢傾偈，可以同佢做一啲佢哋中意做嘅嘢，等佢唔好成日瞓覺咧，係非常非常之有用嘅，係可以防止個神志失常嘅。
So I think these are some of the most important ones. So the top one is to bring in familiar items from home. So these can include photographs, blankets, other items. And this can help with providing the patient things to help them reorient themselves and also just creates more of a calming, just familiar environment, which can be really helpful. And it's also nice for providers because then we get another way to learn about the person in the hospital, seeing pictures of family members, of pets, of trips. All these things are things that I think help engage everyone in their care and just make it a happier place.
咁咧，如果係家人咧，係可以做一啲係喺屋企帶啲嘢嚟，係俾個病人 探佢嘅時候咧，等佢係覺得好似係呢啲嘢我知嘅係屋企嗰啲嘢嚟，我即係等佢覺得舒服啲嘅啦。咁咧亦都可以幫到呢啲人咧係會有一個比較冇咁陌生嘅感覺喺醫院嗰度，冇咁驚啊。咁啊，你可以帶到屋企嘅照片啊，或者天啊，或者係你如果係見到佢有啲咩嘢好似有啲唔妥咁咧，你就要可以，因為你係識嗰個病人多過啲醫生同埋護士識個病人噶嘛，咁你咧就提醒下啲醫生護士話俾佢哋聽話，佢而家做呢啲嘢平時冇做嘅喎，好似有啲奇怪喎，或者你覺得個病人咧已經係好似有啲係神志唔係幾清啊，或者係佢平時冇瞓咁多嘅喎，話佢平時嗰啲記憶力好好嘅，點解而家咩咧佢唔記得嘅咧？咁即係你呢啲咁嘅 tips 咧，同埋嗰啲醫生護士溝通咧係好重要嘅，係可以幫到佢哋咧知道個病人情況咧係喺度變緊好啊，因為係變差咗嘅。
And most importantly, by being aware of what delirium is, you can hopefully now help recognize it. And so when you notice a change, if you notice a change in your family member when they're in the hospital, you can then tell their nurse or doctor that you've noticed this change. And that will make sure that the care team can investigate if this person is delirious and why that might be.
咁當你如果係見到有啲咩同個病人有啲行為係同喺屋企嘅時候唔同嘅時候，你話咗俾照顧佢嗰啲醫護人員聽嘅時候咧，佢哋咧就可以去查下佢而家嗰個病人咧係咪有呢個 delirium， 係咪個神志不清，同埋係咩原因，咁咧就可以幫到個病人走翻出嚟，即係唔使咁長時間喺呢個神志不清嘅。
I think there's an emphasis on the doctors and nurses being on the front lines, but it's important to recognize that the family is also on the front lines.
所以Dr. LaHue 咧，你聽佢講已經知道佢係一個好好嘅醫生係咪？因為醫生唔係話自己叻晒，咩都係一言堂自己講。其實我哋好多時喺醫院嗰度做嘢，唔理係醫生好護士好啦。如果係同個病人同家屬咧有個好嘅溝通咧，真係事半功倍咯。所以你哋做家人如果係去探病啊咩嘢咧，嗰個同醫護人員溝通嘅消息咧係非常之重要嘅。所以我哋係提醒你係要咁樣做，多啲同啲醫護溝通，就因為你哋嗰個消息咧係會幫到佢哋。去照顧呢個病人更加好，等佢快啲出院。
If delirium is diagnosed, unfortunately, we have no treatment that we can provide. But what we do is we investigate what the underlying cause is for delirium and then treat it. So, for example, providing treatment for urinary tract infection or COVID or whatever else might be causing the delirium.
咁咧，呢個神志不清呢樣嘢咧，就係冇得醫嘅，亦都冇藥可以俾佢一個病人食咗就可以等佢神志清醒翻啊咁嘅。所以咧，但係我哋咧就可以去查根，就睇下佢乜嘢事係整到佢神志不清嘅咧，就喺個根嗰度嚟到醫治佢。OK， 咁啊，譬如如果佢係因為尿道發炎，所以神志不清嘅，或者佢神志不清但係有尿道發炎咧，咁我哋就知道可能係因為呢個尿道發炎令佢神志不清，我哋咪去醫嗰個尿道發炎咯，係咪？咁或者咧係有其他嘅嘢，可能佢日頭瞓得太多，夜晚就唔瞓得夠，咁變咗啲生活顛倒咗，令佢神志不清嘅，我哋咪要調翻轉頭，等佢日頭醒啲，唔好瞓咁多咯。即係有啲嘢咧係可以幫到個病人，但係咧就係喺側邊嗰度咁樣去幫佢嘅。
So caring for someone who became delirious continues even once they leave the hospital. And so I think it's important to recognize some of the other complications that can come from that. So a major one is that depression can occur in about 30% of people who are cared for in the intensive care unit.
住喺呢個醫院裏邊嘅深切治療部咧，當然啲病人係非常之嚴重啦，病得。咁我哋咧就有啲特別嘅嘢係要留意嘅。第一就係大概有30%嘅病人啊係有呢個憂鬱症嘅。
And then post-traumatic stress disorder is also quite common because of being in the intensive care unit can be a very traumatic experience, as can even just having delirium, especially if you have hallucinations or other behavioral changes. Also, from being in the intensive care unit, that can affect how someone thinks. And so you may notice memory problems that after someone leaves the hospital. And having delirium in the hospital can increase the risk of all of these problems that might occur.
咁咧喺深切治療部嘅病人咧，亦都有1成至2成嘅病人咧係有呢個創傷後嘅應激障礙啊嚇。咁咧就亦都有3成嘅人咧係可能係個記性冇咁好啊，認知有問題啊，咁出院嘅時候咧都可能有啲問題，所以我哋係盡量會睇到，盡量去揾出呢啲咁嘅情況咧，就盡量幫佢改良咗，就希望佢返屋企嘅時候冇事。
And so it's important to recognize these symptoms in your family member and then seek medical help if you recognize them.
咁你如果係見到有呢啲情形咧，就真係非常之重要，係你將件事係話俾我哋聽，有邊啲咩唔妥咁樣咧，就等啲醫生去揾方法去幫助個病人。
Next, I'll briefly touch on headache, which is one of the most common complications or most common symptoms in COVID infection, which occurs in about 25% of people.
咁頭痛咧，大概喺醫院住院嘅病人咧，係有1/4嘅人咧係有頭痛嘅情況嘅。
Headache is one of the most common presenting symptoms of someone with a COVID infection. It can occur during or after the infection. It's something that can even last for weeks after the infection has resolved. And this can also be associated with the fever, sore throat, and loss of sense of smell that are also very common in COVID infections.
咁唔係個個醫院嘅病人都係有呢個新冠肺炎嘅，但係新冠肺炎嘅病人咧，頭痛咧係佢最常出現嘅一個症狀之一嚟嘅。咁大概4個人之中咧，有1個人會有頭痛嘅。咁咧就佢喺感染嘅期間咧可以出現啦，但係感染完咗好咗之後咧，都可能繼續有頭痛嘅。咁咧就通常頭痛嘅時候咧，就可能有其他嘅症狀添嘅，就譬如發燒啊、喉嚨痛啊，或者係失去咗味覺、嗅覺啊嗰啲咁嘅嘢一齊出現嘅。
And so because headache is so common, it's important to know when a headache might be very serious and you need to seek medical attention. These are just some examples of what you might notice. This is by no means exhaustive, but some of the most concerning signs we might see with a headache include these things.
咁咧，因為頭痛係一個咁常出現嘅症狀咧，咁好多時頭痛我哋都唔會話去醫院或者睇醫生㗎嘛。咁到咩嘅情況之下先至去睇醫院、去醫院或者要睇醫生咧？咁就係當然係如果你真係個頭痛非常之犀利嘅時候，你頂唔順啦，咁你要去醫院嗰度啦，係咪？或者要打電話俾醫生，或者你瞓緊覺，突然間瞓緊覺扎醒咗，係因為頭痛。
So if a headache is maximal intensity at onset, so you can imagine if it feels like a thunderclap all at once, it's incredibly severe. That is something that is very concerning, and you should seek medical assistance immediately. As if a headache wakes you up from sleep, or if a headache comes on and it's associated with some sort of neurologic symptom, like problems talking, weakness, things like that, or if it comes on with confusion as well.
咁繼續講咧，就係話，既然頭痛咁常見嘅症狀咧，咁呢啲咧就係你需要去行動嘅時候啦，就係要即係譬如打電話俾醫生或者去醫院啦，就係話你要喺夢中嗰度瞓緊覺，而個頭痛突然間整到佢醒嘅，或者個頭痛係非常非常之大嘅，或者咧就係有其他嘅神經嘅症狀出現嘅，譬如係個面啊，可能係好似歪咗啲啊，或者係個身體一邊冇力啊，或者係有其他嘅症狀咧，即係唔止淨係頭痛咁簡單，咁嗰啲咧就非常之嚴重，你要即刻行動嘅。
So briefly to talk about stroke, since this is a very important neurologic emergency that we should talk about. there are two main types of strokes that we think about. The first one is the most common type of stroke that we think about, which is called an ischemic stroke. And all that means is that there's something blocking a blood vessel, and it makes it harder for the brain to get the blood that it needs to function properly.
咁我哋講一講中風啦，因為正話講開頭痛咧係可以係中風嘅先兆嚟嘅，咁所以係一個非常之重要嘅問題嚇，所以唔好話有頭痛唔理佢。講到中風啦，咁中風咧就有兩大種嘅，咁其中一種咧最多人有嘅咧就係個血管塞咗，即係條血管嗰度塞咗冇血道，所以個腦部就失去咗功能啦。
And then the other type of stroke is called a hemorrhagic stroke, which just means that instead of the blood vessel being blocked, the blood vessel breaks, and so it causes bleeding in the brain.
第二種咧，第二大類咧，呢啲係好多中國人有嘅類嚟嘅，就係個腦管出血啊，喺個腦裏邊嗰啲血管爆血管，咁咧就有啲淤血積咗喺個腦嗰度，咁呢個就係第二類嘅中風。
So unfortunately, COVID does increase the risk of stroke, and we know this because there are studies that compare people with COVID infection versus other respiratory infections like flu, and we can see there's the rate of stroke in someone with COVID is much higher than in someone with flu, though the overall rate still remains low.
咁咧就係話而家呢個新冠肺炎啦，有新冠肺炎嘅朋友咧，佢中風嘅機會咧係增加咗嘅，增加咗幾多咧？就唔係話太多，但係都係多咗嘅。咁我哋睇到流感咧嘅中風嘅機會咧就係0.2%，即係1000人有流感，有2個人咧可能會中風。咁咧喺新冠肺炎嗰度咧就1000個人嗰度咧就有16個人會中風嘅，可能會中風嘅。咁係因為呢個新冠肺炎中風嘅，咁所以個病率係高咗嘅。
So the risk of stroke increases with the severity of the COVID infection, and the risk of stroke isn't just while someone has the infection, but that increased risk can last for several weeks after the infection has resolved.
咁呢個亦都係非常之重要嘅環節咧，就係話呢個新冠肺炎咧嗰個風險令到會中風嘅風險咧，就係同個新冠肺炎嘅嚴重性咧係成正比嘅，即係佢病情嚴重啲，多啲症狀或者要入醫院嗰啲咧，佢嘅中風嘅機會係大啲嘅，即係唔係話個個都平均係1.6%，係有啲人咧就冇咩風險，有啲人咧就多啲風險。咁但係咧佢就唔止話係喺有新冠肺炎呢個期間嗰個中風嘅風險增高，係完咗之後嗰個中風嘅風險咧都仍然存在幾個禮拜嘅，所以大家可能要留意下。
These are some of the main symptoms that can be recognized if your family member is having symptoms of a stroke. And so if you notice these symptoms, it's incredibly important to call 911 and get medical assistance as soon as possible. And there's a mnemonic to help remember this, which is FAST, which corresponds with symptoms seen in various parts of the body.
就係既然中風嘅風險增加咗咧，咁非常之重要咧，就係各位對中風嘅風險係留意下啦。係乜嘢係中風風險咧？就係我哋英文咧就用 FAST FAST 4個字，就係代表面部、手部同埋講嘢，同埋咧係要你如果知道有呢啲問題嘅時候咧，要及時要打911嘅。咁面部咧就係一邊面可能唔喐啦，笑即係個樣成個人個面歪咗咁啦嚇。咁嘅手咧就一邊冇，好多時都係一邊嘅，手臂咧可能係冇力，唔係喐唔到喎，係突然間冇咩力啊，覺得好似係用唔到力咁嘅。咁講嘢嘅時候有困難啦。咁咧呢3個咧就係個症狀啦。咁你如果有呢3個症狀嘅時候咧，就請你要立即去打911，唔好等邊個翻嚟屋企車你去醫院啦嚇。
So if you notice any change in how the face looks, so it might look droopier on one side all of a sudden, or if there's sudden weakness of an arm or leg, or changes with speech, so being able to get the words out or having the words not make any sense, all of these things can be signs that your loved one is having a stroke, and so you need to get help right away. So this is another mnemonic that I'm mentioning because the first two symptoms are important to remember and are often forgotten when thinking about common stroke symptoms. So I wanted to be sure to mention them here, which specifically are someone all of a sudden has problems with balance and coordination, or they suddenly lose vision in one or both eyes. These are things that can be symptoms of stroke, and again, it's important to get help right away.
咁呢個咧就係新嘅，即係比較新嘅認識中風症狀啦，就係加咗兩樣嘢落去嘅，一個咧就係嗰個平衡啊，身體嘅平衡咧，有即係呢個中風嘅病人咧，可能咧就係一邊佢可能個身體一邊係弱啲咧，咁佢係好可能會跌親嘅，行路嘅時候側埋一邊啊咁樣，或者係覺得係好似即係好似就嚟跌咧就嚟跌啊咁啊，同埋隻眼咧睇嘢咧係可能一隻或者兩隻眼咧都睇嘢唔清楚嘅，可能係蒙查查，突然間蒙咗嘅。咁呢個就係加咗眼同埋呢個平衡呢兩個問題，係加咗落個面啊、手啊同埋講嘢嗰三個症狀嗰度嘅。咁所以有呢啲咁嘅症狀嘅時候咧，尤其是曾經有個新冠肺炎嘅病人咧，你就要特別留意，可能係一個中風嘅先兆啦。
There's a lot that you can do to reduce your risk of having a stroke. And so it's important to have your blood pressure checked regularly and treat it if it is high, to manage diabetes if you have that, and to also treat high cholesterol.
咁咧，中風係咁危險嘅事咧，所以大家係希望你能夠盡量係保持你嘅健康，遠離中風呢樣嘢咧。咁啊點樣去做咧？就係首先你嘅高血壓咧就要受控，你嘅糖尿病嗰個血糖咧亦都要受控。咁咧，如果你係有高膽固醇咧，咁你亦都要將嗰個膽固醇降翻低佢。咁如果你做到呢三樣嘢咧，就可以將呢個中風嘅機會咧係大大減少嘅。
Other things that are very helpful for reducing risk of stroke are getting help with quitting smoking if that's needed, paying attention to your diet, and then also exercising regularly.
咁另外兩樣嘢都係非常重要嘅咧，一個咧就係如果係食煙嘅朋友，唔該你戒煙。咁如果你係平時食嘢係冇咩留意嘅，係乜都食嗰啲垃圾口咧，就可能而家真係要揀飲擇食，係要食啲健康啲嘅嘢啦。同埋咧，跟住咧就係當然係運動多啲啦。
So we talked about the different signs of delirium and how to recognize them. We went over how headache is something that's really common in COVID infection, and some of the symptoms that can be dangerous, recognizing signs of stroke and when to seek help. And then also always a reminder to get vaccinated to help prevent all of these potential complications of COVID.
咁一句講晒咧，如果你哋係知道呢啲神志不清頭痛同埋中風呢啲咁嘅嘢咧，係可能喺醫院嗰度發生，或者係有新冠肺炎嘅時候係會更加普遍嘅時候咧，就希望你哋唔好俾呢啲情形發生，希望你哋盡快打你嘅疫苗。如果未打嘅，快啲去打；如果係打咗嘅，就睇下你嗰個加強嘅疫苗嗰度打咗未，就亦要去補針啦。Thank you so much, Dr. LaHue.
Yeah, well, you can always email me with any additional questions.
如果你哋仲係有啲咩問題未問嘅咧，係可以寫喺嗰個 Q&A box 嗰度咧。咁我哋係會將嗰啲問題俾Dr. LaHue，然後答翻你哋嘅。OK， 多謝各位。Thank you so much, Dr. LaHue. So let me introduce Dr. Lekshmi Santhosh. Dr. Santhosh is an assistant professor of pulmonary and critical care medicine at UCSF. Dr. Santhosh graduated from Harvard Medical School and completed her internal medicine residency and training, chief residency, and pulmonary critical care fellowship training at UCSF. She has won several awards for clinical care, education initiative, and medical education research. Her main areas of research center on critical care education, diagnostic reasoning, transitions of care, and women in leadership. 咁 Dr. Santhosh 咧係喺 UCSF 嘅肺科同埋呢個重症治療科嘅助理教授嚟嘅。佢咧就喺哈佛醫學院畢業啦，就喺 UCSF 嗰度，跟住咧就嚟咗 UCSF 呢度做住院醫生嘅培訓，咁咧就做咗呢個首席嘅住院醫生嘅。咁就佢完成咗培訓完呢個住院醫生之後咧，就繼續留低就做呢個研究員嘅培訓，就喺呢個肺科同埋重症治療科嗰度做研究。咁佢嘅臨床治療啊，同埋醫學嘅教育啊，咁諸如此類咧，就獲俾咗佢好多個獎嘅。咁呢位係一個非常之叻、非常之好嘅醫生嚟嘅，係熱血滿騰啊，係好想幫人嘅醫生嚟嘅。咁佢最重要嘅研究領域咧，就係重症治療科嘅培訓教育。
So thank you, Diana, for the kind introduction. I'm Dr. Santhosh. I direct our long COVID clinic at UCSF, and I'm going to talk about what do we know about long COVID.
咁我哋今日咧就講長新冠啦。你到底識幾多長新冠嘅嘢咧？
No conflicts of interest. First off, I just wanted to start by acknowledging that this is such a serious illness that has killed almost 1 million Americans.
呢個新冠病毒咧係已經殺咗我哋差唔多100萬個美國人。
I personally have had family members affected and pass away, and I know many of us in the Bay Area have had the same.
Dr. Santhosh 自己都有家人曾經係染咗呢個新冠肺炎咧，而失去生命嘅。咁我相信係佢亦都相信在座之中嘅朋友，你哋可能都識得有親人或者朋友咧，都係有咗呢個新冠肺炎而受苦嘅。
I remember it was just yesterday when this statistic came out of 100,000 lives lost, and now we are near 1 million.
呢件事好似係琴日先發生嘅咁嘅，就係嗰陣時睇報紙咧，就只係有10萬個人死，因為新冠肺炎死嘅。但係而家咧，喺而家咧今日咧已經成100萬，由10萬變咗到100萬，即係增加咗10倍。因為呢個當然係舊年5月嘅報紙啦，即係大概係1年前啦，1年增加咗10倍。
Where we're at today is that the cases are overall down, but it's not completely gone away, and in fact, cases are slightly going up again.
我哋睇呢張圖咧，見到佢突然間 peak 咗，然後降低啦，呢個就係嗰個 Omicron 嗰個病情啦嚇。咁而家咧好似冇乜 case 咁，但係其實唔係嘅。而家其實又開始喺度嚟到，好似增加翻嚟，即係開始又升高啲咁多啦。
We know that COVID affects not just the lungs, but actually multiple parts of the body, the heart, digestion, kidneys, immune system, and even reproduction and fertility.
我哋其實中文名叫呢個病新冠肺炎咧，有少少嘅誤導性嘅。我哋以為淨係個肺，其實唔係嘅。呢個肺炎，呢個新冠病毒咧係全身周圍走嘅，咁咧就影響不同嘅器官啊，心啦、肺啦、腦啦、腸胃啦，周圍都有佢嘅份嘅，嗰啲肌肉啦、骨啦咁樣，周圍都有佢嘅份兒嘅。
And we also know that there are longer-term outcomes too, also all over the body, heart, lungs, and brain.
咁咧就呢個我哋都知道咧，佢亦都有個後遺症咧，係唔止淨係個肺嘅，係心啦、腦啦、精神啦、精神科啦，同埋嗰啲神經肌肉啊嗰啲咁，通通都可能有啲後遺症嘅。
And some people have a little bit of symptoms that can go up and down or wax and wane with a lot of fatigue, and there may be a connection with chronic fatigue syndrome too.
咁可能有啲人咧個病情過咗之後咧，以為好翻啦，但係其實係唔係完全好翻嘅，係覺得個人咧同以前係差咗好遠嘅，係好容易攰，而且係日日都係咁樣嘅。
So what is long COVID?
咁到底嘅長新冠係咩情況咧
Long COVID was actually a word that was made by the patient community on social media first.
呢個病名咧，其實係由社區嘅人士，即係在座各位啦，你哋製造呢個名出嚟嘅，唔係醫生俾嘅名，係社區俾嘅名。
We know that patients after recovery, whether they have mild illness or severe illness, can have symptoms that still go on or persist after COVID. And that's what they're referring to by long COVID.
我哋知道咧，病人有咗新冠肺炎之後咧，佢哋係完咗個新冠肺炎嘅疫情，佢哋仲會有啲症狀，係唔係完全好返嘅，所以先至俾咗呢個咁嘅名叫做長新冠。
We also have a lot of research in the Bay Area, like at UCSF with Dr. Peluso here, who's studying why different people have different symptoms that may last after long COVID. And if you want to participate in this research, if you look up UCSF link study, they're always looking for more patients.
呢個長新冠咧，而家係其實喺美國係有好多大型嘅研究喺度做緊嘅，因為佢關係得太多人啦。咁咧，就算係我哋灣區咧，喺加州，即係我哋自己加州大學三藩市分校咧，都有一個叫做 Link 嘅 study，LIINC。咁咧，如果你係去上網去查佢咧，就打 UCSF， 然後加 Link LIINC 咧，咁你就會睇到呢個研究嘅佢而家喺度招募緊人士啊，即係可能係想揾多啲人去做研究查，等我哋認識呢個長新冠係咩嘅情況，係轉而可以幫到呢啲人士咯。
People can have symptoms for the first couple of weeks. That's kind of normal with just recovering from the acute infection. But if symptoms last up to 2 months after infection, talk to your doctor about could this be long COVID.
咁我哋如果係啲病人係有呢個新冠肺炎嘅咧，咁可能係1-2個禮拜都可能有嗰啲症狀啦。但係當你嗰啲症狀係多過1個月、2個月都仲有啲咁嘅症狀嘅時候咧，就可能你有除咗新冠肺炎之外，就已經有長新冠啦。咁咧，你就要揾醫生去查下呢個情況，睇下你係咪真係有長新冠，然後再喺嗰方面去繼續治療。
The other tricky part is that the symptoms don't necessarily mean that the organs are not working. And so some people can have a lot of symptoms, but their lung testing or their heart testing may come back normal.
Santhosh 醫生咧就係話，你可能係覺得係冇咩症狀嘅，但係咧你個人係好攰嗰啲咁嘅嘢啦。但係如果你去查你個身體嗰啲器官各方面嘅嘢咧，你可能係查唔到咩出嚟嘅，嗰啲結果檢驗嗰啲結果翻嚟，可能可以係好正常嘅。
So who gets long COVID?
咁到底邊個先至會有呢個長新冠呢個病症咧
？We know that racial disparities and racism can affect all different types of COVID care, from who gets COVID to COVID outcomes and long-term care.
咁呢個我哋一路都知道嘅，種族嘅差異咧，同埋歧視咧，係會影響呢個新冠嘅肺炎嘅護理嘅。
Latino patients, Black patients, Asian patients are all at high risk.
咁所以咧，除咗白人之外黑人西班牙人亞裔通通都可能係有多啲呢個護理上嘅問題嘅。
Some of that can be because of our occupations, what we do for work, or our family structure that we live with parents and grandparents.
咁有一部分咧就可能係因為我哋工作關係啦，即係做啲咩工啦，或者係家庭嘅環境住埋一齊一家人住埋一齊即係容易個交叉感染嗰啲咁嘅環境啦。
So it's really important for us at UCSF and beyond to pay attention to these disparities and to fight for equal care for everyone.
咁所以咧，我哋尤其是我哋呢個大學啦，就好注重呢啲同等嘅待遇、同等嘅護理咁所以但係大家各位咧都可能喺呢方面要留意下嘅，即係你哋如果係病咗嘅時候，你哋入咗醫院嘅時候，會唔會因為你嘅膚色唔同， 你唔係白人而受到不同嘅待遇咧？
One other thing to note is there is no one long COVID experience. Some patients will have a lot of trouble breathing or chest pain. Others have a lot of brain symptoms like Dr. LaHue talked about. And so there's a big difference and big variation.
咁咧，大家要知道咧，就其實我哋話長新冠呢個病咧，其實佢唔係得一個症狀嘅，佢係有不同嘅症狀，係可能每個人嘅感受唔同，個症狀係唔同嘅，所以呢個唔係一個單一嘅病嚟嘅。
Sometimes people have shortness of breath, cough, anxiety and fast heart rate, chest pain, cough, back pain, joint pain, or abdominal pain.
咁你見到呢啲就係不同嘅症狀啦，佢就將佢分咗入5大組嗰度，一個咧就係唞氣啦，有問題啦，一個咧就係個精神有問題啊，個人好焦慮，咩嘢都好怕，好驚啊，咁咧個心跳咧就影響到心跳好快嘅。咁啊一個咧就係嗰啲肌肉啊、啲骨啊咁痛啦，咁啊另外咧就個肚咧都有問題嘅，就係有時肚痛啦，有時咧就好似作嘔咁樣。咁咧當然有個心臟嗰度可能有胸痛。
And like I mentioned before, some people have symptoms that are similar to chronic fatigue syndrome as well.
咁咧就有啲人咧就好似有呢個即係成日都係攰嗰個症狀嚟嘅。
At UCSF, we have our long COVID clinic where we have a lot of different specialists like lung doctor, geriatrics, taking care of older people, psychiatrists, neurologists, all work together to take care of patients who are in the hospital with COVID.
咁喺UCSF 即係呢個加州大學呢個醫療中心嗰度咧，我哋係特別設咗一個新嘅部門，呢個新嘅診所咧就係專係醫長新冠呢個病嘅，咁咧就由各種不同嘅專科嘅醫生咧走埋一齊咁樣，大家合診嘅，咁佢叫做呢個長新冠深切治療後嘅專科合診診所，英文咧就叫做 Optimal Clinic。
Basically, this slide shows that we can refer to a lot of different specialists for what the patient needs.
咁主要嚟講咧，就係好多嘅專科一齊合診啦，有一種精神病啊、心臟病啊、腦病啊、肺病啊、不同嘅病啦，就算係呢個感染科啊，同埋有埋啲支援嘅小組嘅人喺度嚟幫手咯，即係你需要有邊個科嘅，我哋都走埋一齊，係嚟到幫呢啲有呢個長新冠嘅病人嚟到做合診嘅。
This is an article for primary care doctors. If your primary care doctor has not heard of long COVID, this is an article to give them or recommend to them, which basically says to order basic blood work and check vitals.
咁咧到底嗰啲醫生要點樣做咧？去幫助呢啲長新冠嘅病人咧，就係喺英國醫學雜誌嗰度咧，就做咗一啲建議同埋指引，去教啲醫生要做啲咩嘢，要查啲乜嘢血啊，檢查測咩做啲咩測驗啊，咁樣去證明呢個病人真係嗰啲症狀咧係由長新冠嘅症狀嚟嘅。
And this slide shows how there's a lot that we can do as patients or family members, self-management. You can basically, like Dr. LaHue said, focusing on a good diet, getting a lot of sleep, quitting smoking and alcohol, and resting and listening to your body.
呢個英國醫學雜誌咧，就除咗教醫生之外咧，亦都教個病人同埋佢嘅家人咧，係點樣可以防治呢個長新冠，或者有呢個長新冠嘅時候，係自己可以點樣喺屋企嗰度應付呢個病情嘅，就係主要嚟講就係食嘢健康啲啦，睡眠充足啲啦，就唔好話將日夜倒轉啊咁樣，同埋如果係食煙嘅朋友咧，就係戒煙嘅時候啦，如果係成日飲酒嘅朋友咧，就唔好飲咁多啦嚇，同埋咖啡因啊嗰啲嘢咧，就即係樣樣都係隨量咯，唔好過量咯，咁呢啲嘢都係可以幫到呢啲長新冠嘅病人快啲好返嘅。
This is a great free booklet online from Johns Hopkins. If you look up online, Johns Hopkins bouncing back from COVID. It's a free guide talking about how to return to movement and exercise after COVID.
咁呢個咧就係由呢個約翰霍金約翰霍金呢間大學嗰度一間非常之出名喺東岸嘅大學，咁佢咧就有出咗一本書仔咧，就係喺個網上面咧都可以攞到嘅，你只要查呢個 Bouncing Back from COVID-19， 佢係裏邊咧講3個病人咧係點樣從呢個長新冠嗰度咧係反彈翻嚟嘅。
This is a key concept, which is that basically you want to be really slow after COVID in returning to your recovery. That, if you can only walk 5 minutes before being tired, be an expert at that 5-minute walk before you increase to 7 minutes and then slowly to 10 minutes. So taking it slowly, resting, pacing yourself.
最重要嘅咧就係唔好過勞。係要慢慢好漸進咁樣去增加你嘅活動，係由開始譬如開始行5分鐘，然後加多2分鐘行7分鐘，然後再加2分鐘行9分鐘，即係好似嗰啲有心臟病嘅病人咧，我哋都係咁教佢哋嘅，即係開始由5分鐘開始，慢慢加上去，整到你個人咧唔好行完之後好似劈晒，係好似打咗仗咁嘅，係即係等到個身體慢慢慢慢去增加呢個負荷，慢慢去適應呢個增加嘅負荷，而唔係會令到身體過勞。
Last but not least, it's not too late to get your vaccines, please. And in some people, the vaccine actually improved long COVID symptoms. So go out and get your vaccine and booster.
咁咧就正話Dr. LaHue 咧又係咁樣講嘅，最尾嗰張圖片又係話叫記住要去打疫苗。咁Dr. Santhosh 咧又係一樣咁講嘅，就係話提各位記住要去打疫苗。咁你要知道咧，我哋唔係話作啲嘢出嚟叫你哋去做嘅，係因為我哋即係嗰啲醫生見到咁多嘅病人咧，佢哋係心裏有數，知道咩嘢真係可以幫到啦。就佢哋覺得打咗疫苗咧可以幫到你哋，唔止係染咗新冠病毒嘅時候，個疫情會輕啲。就算係完咗嗰個病之後咧，嗰個喺個長新冠嘅過程之中咧，亦都可以等你應付呢個長新冠，等佢快啲過去嘅。所以希望大家打針。
And last but not least, I know a lot of people even myself, haven't been going to the doctor regularly in the last couple of years during COVID. So please know that all of these long haul symptoms is not necessarily COVID. I personally have seen patients with metastatic cancer or new inflammatory bowel disease or new conditions that they thought was long COVID, but it was actually new cancer. So please go to your doctor and don't assume it's just COVID.
咁所以咧，我哋又要提大家一樣嘢咧，就係喺呢個新冠嘅疫情之中咧，好多人咧都係避免去睇醫生，避免去醫務所醫院呢啲地方可能碰到其他嘅新冠病人，咁咧就惹咗即係可能領嘢嘅。咁但係而家咧個疫情緩和翻嘅時候咧，亦都係時候提你哋去做翻你哋平時應該做嘅身體檢測。每年你哋都應該去做身體檢測嘅，係嘛？咁因為有時咧嗰啲症狀你知啦，全身嗰啲器官嘅症狀都可能有症狀嘅。咁你如果係以為話嗰啲症狀係真係長新冠嘅症狀咁可能唔係嘅喎，咁可能係因為有其他癌症或者有其他心臟病諸如此類嘅症狀係需要處理嘅。咁所以咧你咧就唔好延遲。你如果有症狀嘅咧，你就真係要去去睇醫生。咁你就算係以為係長新冠症狀都好，你咪可以去長新冠嗰個醫務所嗰度睇咯。咁睇咗嘅時候，嗰啲醫生就會同你去做細心嘅檢查，就知道係咪真係長新冠咧，抑或係有其他嘅嚴重嘅疾病嘅。所以千祈唔好諱疾避醫就唔去睇醫生啊。
In conclusion, this is an evolving condition and we're still learning a lot, but make sure to think about the whole body, lungs, brain, physical health and mental health.
咁我哋就即係實實在在咧，呢個新冠病毒咧都係呢2-3年發生嘅事，一路咧都係一個學習嘅過程。咁學習過程之中咧，嗰個病毒又一路變種啦，咁跟住有長新冠呢樣嘢出現啦，咁一路都唔停嘅。咁 咁所以咧，啲醫生咧其實都係一路自己都喺度學緊嘅，佢一路幫緊你哋，亦都一路學緊。個病毒亦一路變緊，咁我哋一路繼續係要將啲醫療嘅情況咧，又要將佢跟住佢去改變嘅。咁所以，但係大家咧就係我一路都係咁話嘅，就係要做一個聰明嘅病人，做一個有理性嘅病人，就知道咧，如果你咁耐冇睇醫生咧，你去睇醫生。如果係呢個身體嘅任何嘅部分有啲咩嘢覺得唔妥嘅咧，都唔好自己去做醫生，要去睇醫生，等醫生去同你查，因為有啲嘢咧係可能要做血液嘅檢查啊，乜嘢照 X 光啊，諸如此類咁樣先查到出嚟嘅。
Thank you to all of my colleagues, and these are my kiddos waiting for me every day to take a shower after working in the COVID intensive care unit before giving me a hug.
咁我哋真係好多謝啊 Dr. Santhosh 嘅，咁佢屋企嗰度即係有啲細路仔咧，佢做醫生喺個病房裏邊，咁樣照顧嗰啲病人咧，而有一部分係嗰啲新冠病人咧，佢自己都好容易感染嘅，所以佢一返到屋企咧，就首先第一件事咧就沖涼、換衫、洗頭，將自己整返乾淨，然後因為佢驚住將嗰啲病毒感染咗自己屋企嘅小童。咁佢亦都好多謝其他嘅同事係一齊喺呢個 Optimal 呢個長新冠嘅特別嘅專科診所嗰度同佢一齊工作，佢係呢個診所嘅主任嚟嘅。
Thank you so much. Happy to take questions and sorry to run over. The question is about UCSF and health equity, and you are right that we can do a lot better in this, but there's a lot of researchers working on health equity at UCSF for all communities. And so check out a couple of these websites that Raymond and I are posting.
What is the chance to be fully recovered from long COVID?
This is a great question. And I would say in my experience, most people will recover in a month with just their recovery from their acute infection. Some people will have symptoms for a couple of months, and a small proportion will take many, many months or even a year. But most people that I'm seeing, almost all, are getting better with time.
咁咧，其實都係好消息嚟嘅，就係呢個長新冠咧，有朋友問話幾耐先至可以復原翻？咁咧一句講晒咧，就係差唔多全部嘅人都可以好翻嘅。有啲人咧就係大部分嘅咧都係頭1、2個月咧過咗咧就好翻噶啦，但係有一小部分嘅人咧就係要等好耐嘅，好多個月嘅，但係幾耐幾多個月咧就唔知，但係始終咧佢哋似乎都係可以全部好翻嘅。
So the second question and third question are both very interesting because we're still learning about why do some people with mild symptoms get long COVID, and some people who were in the ICU had some severe symptoms but not too bad. So it's a puzzle that's still being researched.
咁第二條嘅問題咧就係話，咁個症狀啊，當你喺有新冠肺炎嘅時候有症狀啊，有啲人冇症狀噶嘛，有啲人有輕微症狀，有啲人嘅症狀非常之嚴重要入醫院噶嘛，咁會唔會係呢啲症狀嘅嚴重性啊會同呢個長新冠啊係有咩關係啦？會唔會係症狀重啲就有多啲機會長新冠嘅，即係得到長新冠咧咁？Dr. Santhosh 咧就話而家呢個係一個非常之好嘅問題，係研究緊，即係暫時仲未有一啲真正知道係咩環境嘅事嘅。當然係我哋想知道啦，但係就可能要多啲時間做嗰個研究先至查到出嚟。Any medications to treat it？ 有冇藥啊？有冇藥去醫呢個長新冠嘅
？I'll take that with number 2. So many, as I showed you, there is no one long COVID experience. There's so many different symptoms. So like Dr. LaHue said, for people with headaches, we treat with different headaches treatment. For people with shortness of breath, we'll treat with different inhalers or treatment for shortness of breath. But there is no one cure for all of it.
即係要對症落藥咯，你係乜嘢嘅症狀，你就嗰啲醫生會俾啲咩藥去醫嗰個部分咯。就而家都係因為 冇一個人係有同樣嘅長新冠嘅症狀嘅，有啲人係依樣，有啲人係嗰樣，有啲人係依樣嚴重啲，有啲人係嗰樣嚴重啲。咁所以咧就要係每個病人去睇咯。所以我哋亦都有呢個咁嘅特別嘅診所去睇呢類咁嘅病人，就係因為真係要每個人嘅醫療都係唔同嘅。咁係有嘅，係有藥物可以幫到嘅，但係我哋要揀用邊啲。What is the most common symptom? So out of all the things getting affected, what is the most common?
Well, it is a respiratory virus, so I think that cough and shortness of breath are the most common symptom. But as I showed you, it really can affect all different organ systems.
咁就正如佢個名叫新冠肺炎啦，咁就最多嘅人咧有嘅病徵就喺個肺嗰度嘅，係有呢個肺炎嘅現象嘅。但係其他嘅係個器官都有好多係有症狀出現嘅。Personality changes. All of a sudden they become a different person, huh?
That's rare. And that's why, again, I would talk to your doctor to get checked out to make sure it's not from a small stroke, or again, could be from something else like a brain tumor that's not necessarily COVID.
咁咧有啲人咧，佢曾經患咗呢個呢個新冠肺炎之後咧，個人嗰個性格係有改變嘅，突然間變得係可能以前冇咁猛啊，或者變得猛咗啊，或者係成日鬧人啊，講啲嘢無厘頭啊，咁即係個精神有狀況嘅。咁所以咧，如果呢啲人有呢啲咁嘅問題嘅時候咧，就可能係長新冠啦，亦都可能唔係，所以就一定要揾個醫生咧去查清楚，去做一啲乜嘢嘅檢查都好啦，就等個醫生去話俾佢聽，呢個到底係曾經中過風啦，抑或係可能係有腦生癌咁，即係可能有其他嚴重嘅情況喺度嘅。
I also would say that depression and anxiety are very common in the pandemic, with or without COVID. So keep an eye out for yourself and your loved ones about getting mental health support.
Dr. Santhosh 咧就係話喺呢個疫情之中唔理你染咗嗰個病毒，因為冇染嗰個病毒咧，我哋都知道係有好多人咧係有呢個憂鬱症嘅，係好唔開心。咁所以咧佢話你哋係如果係覺得係呢啲咁嘅症狀係影響你嘅生活嘅時候咧，就可能要揾啲精神醫生去睇下，去揾啲支持嘅群組去幫一幫你走出呢個陰霾。
I know we don't talk about mental health enough in Asian culture. I know that from my own family, so it's very important to talk about.
咁咧佢咧就話可能係因為即係我哋大家都係東方人啦，即係亞裔啦，咁我哋自己喺呢個疫情之中咧都知道係有好多嘅嘢發生，係亞裔嘅，特別係影響亞裔呢個群組嘅。咁所以佢即係提醒大家係自己希望你哋保重，同埋有咩事嘅時候就去睇醫生，就唔好拖遲啦。你覺得自己成日都唔開心嘅咧，你真係可能患咗憂鬱症，咁你要去睇下精神科去攞啲幫助。So thank you so much, and I want to thank everyone for joining us. It's a serious illness that we have yet to learn more about. We are very thankful that Dr. Santhosh helped us kick off the ball here and start talking about it. And then as more and more things comes about from the good research that you all do, then you can come back and share with us again when you have new data.
Thank you, Diane. Very kind.
Thank you. So 我哋咧就當然係好多謝 Dr. LaHue 同埋 Dr. Santhosh 嚟到同我哋做呢個講座啦。我哋都要多謝喺我哋背後 support 我哋支持我哋呢啲做呢啲論壇嘅員工同埋義工嘅。咁咧就係 Sandy 啦、Cliff 啦 ，Cliff 今日唔喺度。咁Raymond 咧 ，Raymond 就成日都喺度嘅。好多謝你哋。Thank you so much.
Thank you. Good night.
咁咧就係提醒大家咧就係你哋如果係未攞嗰啲快速盒咧，未用過嘅咧， 你哋真係可以用嘅，用呢啲快速盒咧。如果你有咩症狀，尤其是你有咩症狀啦，好似我淨係咳咁樣，咁我陣間咧又要用個快速盒去 test 下 ，make sure 唔係有呢個新冠嘅病毒嘅。咁啊，當然我自己知道自己事咧，我就唔係嘅，因為我個喉嚨嗰度成日都係有少少敏感啊。咁但係咧就但係大家各位都係可以盡量去用呢啲咁嘅測試盒咯。你未用過嘅時候，頭一兩次咧可能唔係熟，但係你用過之後咧，你就覺得係非常之容易嘅。咁啊，你係每個月，如果你係有呢個保健計劃嘅咧，你係每個月咧都可以去嗰啲 CVS 啊，或者係 Safeway 或者即係佢指定嘅地方咧，你係可以去攞呢啲快速嘅測試盒嘅。hi@ucsf.edu 啦，有咩問題啦？或者你想加你嘅名入嚟我哋個電郵組嘅啦，係可以請你 email 俾我哋嘅。我哋亦都有個網址係 ahi.ucsf.edu， 咁呢個網址咧就係可以上面有好多嘅資料嘅，新冠嘅資料又好，其他病嘅資料又好啦，係你可以上去瀏覽下睇下有啲咩嘢係啱你用嘅。講翻嗰句啦，就係如果大家未接種嘅，仲有啲人士未接種嘅，就請你快啲去接種啦。但係有一樣嘢咧，因為而家其實嘅疫情咧，真係唔可以話過咗咯，即係少咗嘅原因咧，就唔係話少咗病人，係少咗住醫院嘅人。咁但係咧，我哋大家因為個疫情未過咧，我哋大家都要保持警惕嘅，大家都要留意住嗰啲資料啊，嗰啲新聞啊，話緊俾我哋聽，我哋而家嘅疫情，即係自己住嗰個城市嘅疫情咧係點樣樣，而大家係有需要嘅時候咧，就可能出少啲街；有需要嘅時候，可能戴口罩。你自己去做呢個決定啦。咁如果係有問題嘅時候咧，就真係要打呢個加強針啊，或者係打呢個疫苗咯。如果你未接種嘅時候，如果你懷疑你自己有如果係懷疑自己係有呢個嘢中咗招嘅咧，就請你去做呢個測試啦。OK， 用個快速盒去做測試。OK， 咁就多謝大家，同埋我哋係今日喺呢度過咗呢個半鐘頭，咁希望大家健健康康，一齊保重。OK， 亦都希望個疫情快啲過。OK， 多謝你哋，拜拜。